Dear students, we'll discuss a postoperative status. Just look into that. See that in this area there is a lot of wound. Now healing, granulating well. So that but wide gap is there, but lax areas. Deep tissues are there. You can always put into that. If you want to able to approximate in still wider area, then you have to put a split skin grafting, tear grafting. Here you can approximate this one. So by what is called as, it's a wound distance in the right inguinal region. So you can always do a secondary suturing in this patient. So what are the wound resistance causes? Diabetes, immunosuppression, anemia, malnutrition, malignancy. Features wound suddenly gives way with the pain and copious urine discharge. That is in the abdomen, not in maybe or not other area. Copious urine is very common in the abdomen, where it is called a burst abdomen. Here just wound resistance. Of course, discharge will be there. So management, discharge culture, proper antibiotic, regular dressing, nutrition improvement, hemoglobin improvement. If diabetes resistance should be controlled, that is also important. Cause should be treated. Any immunosuppression, all other things should be considered and treated. So finally, allowing the granulation to come up properly, to eventually to do a secondary suturing. Secondary suturing is, primary suturing is suturing immediately within 24 hours. Secondary suturing is in 48 hours, because once edema subsides and in 48 hours, then you can suture. That's called delayed primary suturing. Primary, immediate suturing. Delayed primary, once edema subsides, that is in 48 hours. Then secondary suturing after 10 days. Infection is there, sepsis are controlled, granulation tissue have to form. Then the wound should become clean. Then you suture it, which will take up very well. Usually such secondary sutures are sutured interrupted, not continuous. Matrix sutures using good non-absorbable monofilament suture material like ethylene, nylon or polypropylene sutures. Cutting needle is used in such situation. Deep bite is taken. Usually deeper suturing is not done. Supporting tissue is not sutured. Sometimes large wound drain may be placed, so that any collection should be prevented in the deeper plane, so that allow it to have a proper healing without any tension. So primary within 6 hours of onset of wound, like in injury trauma. Delayed primary within 48 hours until edema subsides. Secondary suturing is after 10 days, mainly 48 hours. This is after 10 days. It's immediately or within 6 hours. So that is the type. Primary, delayed primary, secondary suturing are the types. You should remember when you use these things. So this is the secondary suturing done to the same patient. See that interrupted suture should be done. Drain is placed. See that corrugated drain is placed, so that nothing collects in the deeper plane, so it gives way again. Usually such sutures are removed after 10 days or after 2 weeks. Keep it longer time, because here healing process is and maturation of the wound is slow. So healing process is slow. So you don't remove the suture in like traditional is 5 or 7 days. Keep it for a long time, 14 days, 20 days, until it seals very well. Then only remove it. Don't remove such sutures early. There is a point you have to remember. Delay is good actually in such patient while remove suture, unlike in a traditional wound closure. So answer the MCQ. A patient with a grossly contaminated wound comes to casualty after 12 hours of accident. How do you manage this? Primary suturing with drain, thorough cleaning with suturing, thorough cleaning with the debridement of all devital tissue without primary closure, thorough cleaning followed by split skin grafting. Put the right answer in the comment box, students. I'll get back to you. So students, go through my SRB's clinical methods in surgery, which has got a video lectures of each topic. So many topics are covered. Every topic as far as CBM syllabus is covered. How to examine the patient. Swelling, ulcer, arterial disease, venous disease, thyroid, breast lump, mass abdomen, briefly orthopedic, every system, whatever your required thing, everything is covered. There is a video of how to examine of each topic, and principles of examination is good, and differential diagnosis in a table format is given, and briefly investigation. Suppose treatment is not a topic will be covered in a clinical method examination, remember, and many photos of the most of the conditions with the illustration. Photos will tell the clear idea about for the students how exactly condition looks like. So covers everything with the beautiful photos, and it also gives the instruments, specimens, then operative surgery briefly. Everything is covered. Small images also it is covered. So it is more than sufficient for all undergraduate, postgraduates of any system to learn very basics is the required thing for the surgical field is clinical methods. So please go through that and purchase that and make use of it. My SRB Manual of Surgery is very popular. It covers a theoretical aspect, everything, principles, treatment in detail, briefly technical aspect, and with the photos, illustrations, quotations, all topics with the specialty, urology, cardiothoracic, neurosurgery, and operative surgery instruments. Again, it is covered in this book also. Every quotations and used worldwide also, actually, including our country, everywhere. And please, you can make use of it. My operative surgery book, SRB Operative Surgery Atlas, that is a 2-volume book, covers in detail operative technique of surgery, all surgery, small surgery, major surgery, everything, with around more than 10,000 illustrations and photos. It gives very good principles and technical, step-by-step technical aspect. Very, very useful for postgraduates. Not much useful for undergraduate, but it's a postgraduate book and consultant book and learner after MS. It gives everything. You can, before going to surgery, you can always read this book. I will memorize your steps and do the surgery properly. Every topic, general surgery, gastroenterology is covered in detail, step-by-step with illustrations. And my SRB's Atlas of Tissue Approximation, small book Atlas, 100 pages, how to do the suturing, tissue approximation, including laparoscope suturing with the video. It is covered. So any basic learners, suturing is very, very important surgical field as a skill actually. Dissection and suturing, so the two parts of the surgical skill. So that is also covered very well with videos. You can always go through that. And my website, please subscribe, all of you. If your daily lectures are there, live sessions are there. My Digihour lecture through JP Publishers, around 220-hour lectures. Entire thing as for CBM is covered with the examination part, with all topics of CBME, ulcer to operative surgery, instruments, specimens, examination, specialties, basic, everything is covered. You can always purchase for 1 year and have a clear idea about the surgical topics, understand very well, and helpful for your exam, NEET, MCQs. Also, it is there both in manual and my lectures. So students, I hope you have understood this lecture very well. Thank you very much.